Hello, I'm Dr. Susan Heitler, and this is Dale Petterson, energy therapist. We're going to demonstrate a few techniques of energy therapy right now. The core technique that most of these energy therapy interventions depend on is muscle testing. Here's an example. I put my arm out.
And I put a little bit of pressure on her arm and ask her to hold strong, and she's able to lock that easily in place.
Testing in the clear refers to just checking what's a yes and what's a no to make sure the arm is accurate, giving accurate information.
Okay, assuming that the arm is giving accurate information, I will say, what is a yes? And I push on the arm, and it's a good, nice, strong response here. If I say, what is a no? The arm goes down. So now we're set up to be able to ask questions of yes and no and find out what the body is telling us.
If a client came in, for instance, with a target symptom of depression, we might want to assess, is there depression now? Now, as far as I know, I'm not depressed. Sometimes, subconsciously, I could be. Let's find out.
Okay. Is there any type of depression within your being at this time? Is there depression with you? No.
No.
Are you then telling us that you are not depressed right now? And the body says yes.
So in this case, my subconscious is reading me the same as my conscious, which is I'm actually pretty happy. Such a pleasure to be getting a chance to do this tape. If I were depressed, there'd be more energy on one side of the brain than the other. If I'm not depressed, there's still more energy on one side than the other, but on the opposite side. Depressed has more on the right, not depressed more on the left. Let's show you now how the testing for where there's more energy in the prefrontal lobes of the brain, how that testing would look like.
Okay, the energy to the prefrontal lobes, is it equally balanced between the right and the left hemisphere? No.
Good.
Okay, is it higher on the right side? No. Is it higher on the left side? Left side is higher.
I wonder how much higher. Should we find out
compared to the right brain, how much higher is the left brain? From 0 to 5, 5 to 10, 10 to 20, 20 to 30, 30 to 40, okay, 30 to 35, 35 to 40, at 35, 36, 37. Is it 37 times greater? Yes.
I must be feeling pretty happy because usually the average is somewhere around 27 or so. So 37 sounds good to me. Here comes an experiment.
Okay, let's just check something here. Right now you are testing not depressed.
Correct.
Have you ever been depressed in your life before? Yes, okay. I want the mind and the body to go back to a time when you were experiencing some type of depression. And this is going to be significant. When was that? Conception to birth. Birth to 10, 10 to 20, 10 to 15, 15 to 20, yeah, 15, 16, 17. Was it at 17? At 17.
I will say that is pretty amazing because I was thinking of an episode when I was 16, 17 in there. Yeah.
Okay. So now at 17 at this point when you're depressed, where is the prefrontal lobe energies? Is the energy higher on the right side? Is it higher on the left side? So now it's testing is higher on the right side. And how much higher on the right than on the left? 0 to 10, 10 to 20, 20 to 30, 30 to 40. Okay, 30 to 35, 35, 36, 37, 38, 39, 39.
Interesting.
So it was a difficult period of time according to the testing here.
Yes. Again, often our clients, and given that this is new, but often we find people are in the range of 27 to 30. So if I was 30, what was that?
37, 38,
yeah.
Somewhere like that.
I was really depressed. I know I was depressed because I remember walking up the hill in front of my house and thinking, oh, I feel like there's such a dark cloud all around me. So let's see if I were, in fact, 17. Let's see if we can go back in time, as we just did, to when I was 17 and see if we can fix the depression
Okay, very
using
good.
these techniques.
Now let me ask your body a question. Is it okay for us to take you back to 17 at that episode of depression and do further testing and treatment with you at this time? The body said, yes, that's okay. Now if the body said no, it went down, we would say, okay, we accept that, we'll go on and do something differently.
Okay.
Okay, so are we ready to do that now?
Yeah.
Okay, so are you depressed here at age 17? Is it okay for us to change the energies of the brain and making the left prefrontal lobes higher? Yes, okay. So now, should we...
So, okay, let's go ahead and see what we can do about this.
Okay, we'll go ahead and do a treatment, and I would like to say something about that treatment when we get done.
Okay.
To do this, we're going to use something that's called a Magboy, which is a powerful magnet, and we're going to roll this down the governing meridian, which just happens to start up here, goes down the back of the spine to the tailbone, but we're just going to rub it down here, run it down here, with the intention to shift those energies from the right side over to the left side. And we just do that 3 times. Now we can come back and ask about the energies. Are the energies higher on the right side than on the left side of the prefrontal lobes? No. Is it higher on the left side? Yes. Okay,
So that means already there's been a shift from a depressed state to a normal or even upbeat state.
And at 17, are you feeling depressed? No.
At age 17, not depressed. Good.
Right.
Let's find out how much higher the energy is on the left than the right.
Okay, how much higher is it now on the right, on the left compared to
On
the
the
right?
left.
From 0 to 10, and 10 to 20, 20 to 30, okay, 20 to 25, 25 to 30, at 25, 26, 27, 27.
That's funny.
higher.
I don't know what's magic about 27, but so many of our clients seem to reset there spontaneously. Let's find out if this is optimal. Oh, go ahead. Did you have something
Oh,
else?
I'm just going to say, we're doing something very unusual. We just go back in time. But the question is, I mean, that was way in the past. Well, I don't want to say too far here and offend her, but it's way in the past. Okay, but now the question that I have is, does this do anything up here to present time? Does it help you in any way? And we don't have to find out why. But
Good. Well, before we move forward on bringing me back into the present time, let's check if you've reset me to an optimal level for age 17. That's what we would do with clients, is we not only fix the depression, at least in terms of the energy in the prefrontal lobes, we also double check if the client is satisfied that this current level is optimal, because if not, we can do the procedure a second time.
okay, and the satisfaction you're talking about is not at the conscious level, it is at the subconscious level here.
Exactly.
Okay, so what the change we made at age 17, I think you were brought up to 27, okay, is this optimal for you at 17 at this time? Yes.
Age 17?
Age 17 is optimal.
Perfect. One of the other oddities about this technique, as you've already seen, is we can move about at different times in a person's history. So we've been at initially in the present tense for me, and then back at age 17. Where do you want to go from here in terms of ages, my age?
Okay, what I'd like to do is to bring you back up at the unconscious level up to your present age.
Okay.
Okay, so are we then clear at age 17? Yeah, so that says we've done everything we need to do with the depression at age 17.
Right.
Then all the way up to present time. Okay, and are we clear at present time?
Yes.
Okay.
So let's see if right now, and I have no idea about this, will I be at the reset you did for age 17, which was at a number 27 times more energy on the left than on the right, or if I'll be at 37, which I was when we started playing around with this.
Okay, so let's just test for where it is at this time. How much greater is the energy on the left side than on the right side?
Exactly.
Okay, 0 to 10, 10 to 20, 20 to 30, 30 to 40, okay, 30 to 35, at 35, 36, 37. So it's 37.
I'm relieved. Where did this idea come from of shifting energy from the right to the left prefrontal lobes to pull someone out of a depressive episode? it's Dale's idea, first of all, the intervention. At the same time, though, both of us had been doing some reading on the brain. Both of us had been noticing that the brain in depression now has been shown to have more energy in the right prefrontal lobe than the left. This is an advance that's come with the new neuroimaging techniques where different parts of the brain light up in different colors depending on how much energy is there. With that information that both of us independently had come up with, Dale said, wait, if we know there's more energy on the right than the left when someone's depressed, how about if we do something about that? You're on.
And to do something that is really non-invasive and has no side effects whatsoever.
At least as far as we've been able to see.
Yes.
Yeah.
And so we're using something called the psychology of intention, which carries a lot of energy, which is to, with that intention, in using the mag boy, is to see if we can get the body to transfer that energy from one side of the brain over to the other side. And according to the muscle testing, it seems like we were able to do that. And this is the way that we would do that.
Yes, come from. Both Dale and I had been doing reading on the findings from neuroimaging. These are the tests where you've probably seen them. There's a picture of the brain with different colors illustrating where there's more energy or less energy. So we both did reading that said multiple studies have found that when somebody is depressed, there's more energy on the right. When someone is happy, in a good mood, in a state of well-being, there's more energy on the left, in the left prefrontal lobe. So then the question is, that Dale addressed, is there something we can do about that?
Okay, and with the psychology of intention, we decided that we would see if it was possible to shift those energies back and forth.
So psychology of intention means if there's something you want to do, and then you enhance that with some energy enhancing like the Mag Boy magnet, the combination of the two can make something happen. This is clearly experimental, and experimental so far just within the green walls of this office. Who have we been experimenting with? We see a lot of clients who are depressed. We thought, this takes about 2 minutes to do. Let's see if it's going to make a difference with some of our clients who are in significant depressive episodes. I want to say something about the first client that you tried this with, because I remember it so clearly.
The first client that we treated was a highly educated young man who was going through a state of depression and was feeling suicidal. And the question was, well, can we do something about it? So we went ahead and used the technique, and within 2.5 minutes, the person said, hey, I can feel the shift within my body, and the depression was lifting. And he came back the next week, and he was still feeling good. A little depression had come back again. And what we learned is this is not a one-time fix. It has to be done periodically to keep the person out of depression.
Now, it seems to me he came back and you did the same brief procedure a second time about a week later. He came back another week or two after that. There's no set schedule. If I remember right, he called you when he began feeling bad again, and then he'd come in for a touch-up. The need for renewal of this procedure got less and less. There were longer periods between. And basically, it's been, what, how long since he's needed?
6 months, 9 months, something like that.
He hasn't been back in quite a while. Eventually it clicked in and it held. Now this may be like antidepressants that it takes a while to kick in, but once they kick in, people begin acting differently and their lives get better, so they continue to feel better. We're in the stage of innovation. We would love if someone out there who has the capacity to do real research in running lots of depressed subjects and doing follow-up assessments and follow-up over time, we would love to see others do that kind of scientific validation. What we do have now at this point, though, is a lot of clinical validation. We've been doing this technique for, maybe 6 months with a number of clients. I would say the success rate is about 80%, something like that. Most people feel significantly better. They might not immediately feel it. It can take 2 or 3 minutes. It can take until the next day before it kicks in. Most people, though, feel lighter, happier. Several people have said, oh, I realize now I've been depressed for years and years and years. This is the best I've felt since I was 8 years old. So clinically, we have much evidence that there is a positive impact. Medical research has established that when people are depressed, their levels of the chemical serotonin tend to be low. That's why several of the antidepressant medications work on the serotonin system so that there's more serotonin in somebody's system. Here's a technique for assessing how much serotonin is in somebody's system and adjusting it using the psychology of intention. How do we test for levels of serotonin? The mind has amazing self-knowledge. So for instance, let's assess my level of serotonin right now. We've established already that I'm not depressed, I'm actually feeling quite good. So my level of serotonin should be reasonably high. Now how do we measure high or low? We say an arbitrary scale from 0 to 10. 10 being high, maybe even too high, I don't know. Let's find out what my level of serotonin is right now.
So I can just ask her body, is it okay for us to check your serotonin levels using this procedure? Body said, yes, that's okay. Now we recognize that this is not scientific and it is clinical, and let's just see where you are on serotonin at 0 to 5, 5 to 10, okay, at 5, 6, 7, 8, 9. Okay, so it's 9.
Great. I'm pleased. There's two ways of asking questions when we're using muscle kinesiology. It can be confusing if you're first watching. Usually this is yes and this is no. That's if Dale asks a direct question. Is it this? Is it that? Sometimes the form of the question is multiple choice. Then yes is down because it means yes, there's stress on that. A little confusing. Let's do an example again right now.
Okay, so again, let's check her serotonin levels at 0 to 5 and 5 to 10. Okay, at 5, 6, 7, 8, 9. So it's still at 9 because that's where the stress is at. Now we could go back the other way and we can say, where is your serotonin at? Is it now at 9? Is it at 10? Just the opposite.
Right, so now yes was this way. So this gives Dale a way to double check that the answer he thinks he got is correct. He asks first in multiple choice, where this is a yes, and then he'll reframe the question as a yes-no. Is it? And then yes is here. When we're testing serotonin levels with clients, in addition to getting a number, we find out is the number where they're at optimal for them, or if that should be adjusted.
Okay, so 9 is very good, but would 10 be even better for you to have at this point in time? No. Mm-hmm. So she might say, hey, I want to go all the way and get the highest I can possibly get, but the body says, no, right now, 9 is a very good place for you to be. Mm-hmm. Would it be better if we went ahead and took you down to 1? No.
Thank you. We've done this technique with quite a few clients now, so we're getting a sense of what people's levels typically are when they're happy. Usually when people are happy or normal, serotonin levels are 7 to 9, would you say? 8, 9 if they're feeling really good. When they're depressed, they could be, if they're significantly depressed, 2 or 3. Lower than that would be really worrisome. Mildly depressed, 4 or 5, maybe even 6. Is that your recollection?
Yes, in fact, we could demonstrate this. Is that let's go back to the age of 17 when you were deeply depressed. We know that the brain changes that had occurred there, but what about the serotonin? What was your serotonin level at that time? At 0 to 5, okay, at 0, at 1, at 2, at 3. So it was 3. I can just ask, was it at 3 at 17? Yes.
Interesting. This technique is Dale's invention. The knowledge about serotonin levels is widespread in the medical and psychological community, but the ability to shift serotonin levels in this simple way, I congratulate you. It's great.